We'll be discussing about the physical examination of respiratory system. But before really go for it, uh, we will discuss the normal applied clinical anatomy of the respiratory system because our purpose must be defined. Uh, During physical examination, what we are looking for, this must be defined and clearly understandable. Okay, so for the purpose to understand the normal anatomy and what we are going for in the physical examination, we must explain before really go to real and physical examination. Okay, so let first focus on the physical examination. It start from the nasal cavity. As you know, respiratory system examination is start from nasal cavity and paranasal sinuses. Okay, we will start from the paranasal sinuses. They are divided into different groups. Some are visible on sagittal section, like in this. This is the sagittal section. You can see here. Okay, some are visible clearly on the. This is coronal section. Sorry, this is coronal section. Some are visible on sagittal section. Okay, let's start from the frontal sinuses. And they are located on the glabella part. If you remember that, this is glabella part. Okay, this is the mid of the frontal sinuses. Okay, glabella, and on the glabella on both sides we have triangular in shape. This structure, okay, or air-filled cavity. Okay, this is frontal sinuses. So during physical examination, we will just press on it. If there is inflammation, okay, or infection or something other, so the pain will elicit. Okay. The next group is the ethmoidal sinuses. This is the first group. This is the next group. Okay. Now the third group, this is very important and most commonly inflamed because it is very nearest to the nasal cavity. This is the maxillary sinuses. And this is why nature provide two clearing duct for the maxilla. One accessory in case of the main duct closed, so the accessory duct will work. I will show you in the lateral wall of nasal cavity in the next slide. Okay. So now come on to sagittal section. So on sagittal section, you can see the ethmoidal sinus very clearly. Okay, so this is frontal sinus. It look like on sagittal section like this. Okay, and ethmoidal sinuses, they are arranged and row. There are many cells, but three of them is considered to be sinuses. Okay, and they name this. This is anterior ethmoidal sinus. Then we have this is the medial ethmoidal sinuses, and this one, and this one we have posterior ethmoidal sinus. Okay, so we have three group of these sinuses, and they are open in the lateral wall of nasal cavity. Now move to the sphenoid bone, and the body of the sphenoid bone, we have the sphenoidal sinus. Okay, and it open in the small slit and the nasal cavity, and this slit they named sphenoethmoidal recess because it is very small. It is not able to call it meatus. It is a very small slit. They name this sphenoethmoidal recess because it's shared by both bones. That's why they name sphenoethmoidal recess. Now let's discuss the lateral wall of nasal cavity, and this is very important slide. Okay. First of all, let's start from the boundary of nasal cavity. Okay. So we will start from the roof of the nasal cavity and the bone forming the roof of the nasal cavity. Okay. So interiorly, here we have ethmoidal ear cell. Okay, ethmoidal ear cell. Okay, and half of this roof is formed by the ethmoidal bone, and half of this roof is formed by the sphenoidal bone. So both they share this roof forming, and the roof is formed mainly by the ethmoidal and sphenoidal bone. Okay. So now coming to the interior portion, so upper 1/3, you can see this is formed by the bone. This is formed by the nasal bone. Okay, and lower 2/3 is formed by the cartilage and adipose tissue, etc. Okay. So now, up to now, we have learned about the roof. We have learned about the interior boundary of the nasal cavity. Okay. So all this structure is, you can see, all this structure is covered by the nasal mucosa. And the nasal mucosa, if we compare the nasal mucosa with the oral mucosa, so it is smooth and more red as compared to nasal mucosa, because we have whitish layer on the oral mucosa, but over here we don't have any whitish color. If you see the whitish color, it will be some infection. Okay, the normal mucosa must be smooth and red, more red as compared to the oral cavity. Okay, so let's start with the our inferior boundary, that is separate the nasal cavity from the oral cavity. Okay, so mainly we have the maxilla. This is maxillary bone. Okay, mainly it is formed by the maxilla, and on the nasal side it covered by the nasal mucosa, and on the oral side it covered by the oral mucosa. Okay, as you can see in this diagram. Okay, and at the end of this we have this projection. Okay, that projected downward. This is the soft plate. Soft plate. Okay, of oral cavity. Okay, so we will be examining oral cavity also. So it is the soft plate is clearly visible from the oral cavity. It is the sagittal section. That's why. So I'm showing that. So now when you see in the nasopharynx, so you can see this. This is Eustachian tube. Eustachian tube. Okay, this communicate with the here. In small children, this is frequently infected because infection uh, easily transfer through this Eustachian tube to the ear. Okay, and this cause infection. And adult also sometimes occur, but frequently in children this occur. Okay. Now let's discuss the internal. Once we know the boundary, okay, we know the roof, we already an interior part of the nasal cavity. Okay, let me draw this with the different color because it's not visible clearly. Okay, so now answer. Okay, superiorly roof is formed by the ethmoidal bone and sphenoidal bone. Okay, interiorly 1/3 is formed by the bony, and 2/3 is formed by the cartilage. Okay, inferiorly mainly we have maxilla, inferior boundary, and a soft plate. But this is very small part participate the soft plate. This part participate to nasal cavity, and the rest are this uh, uh, this projected downward. Okay, this projected downward to the oral cavity. Okay. Now, once you know the boundary of nasal cavity, now we will discuss the internal structure of lateral wall, because this is very important. Why this is important? Because all the paranasal sinuses opening in it. Okay, and you will be examined during physical examination each opening, and you must locate. Okay, you must locate where is the opening, a particular opening in which specific meatus and which specific part of the nasal cavity. Then you will be able to examine well and to understand that which particular sinus has been inflamed. Okay, so let's start from the superior, the sphenoid sinus. Okay, so this is the sphenoid sinus. You can see here it located in the body of sphenoid bone, and this is its opening. Okay, so it open in the small slit. This is small slit. This shared by the two bone, That's why they name this sphenoethmoidal recess. Okay, sphenoethmoidal recess. So this is a small slit that occur under the ethmoidal bone and sphenoidal bone, and upper side the superior concha. This is superior concha. Okay, this is middle concha, and this is inferior concha. Now you know that it's clear. Okay, this concha is nothing but this is a bony projection that projected from the lateral wall into nasal cavity, and between the two concha is the projection. They form a slit, a free space in between the two concave, and this free space contain paranasal sinuses, and we will be discussing this. Okay, so now let's start to discussing the paranasal sinuses and its opening. Okay, now we will start from the sphenoidal bone. The sphenoidal bone is open in the sphenoethmoidal recess. Okay, now then we have superior concha. And under superior concha, between the superior concha and medial concha, we have ethmoidal sinus. Okay, remember we had three. I have mentioned before that we have interior, the most interior one, and behind we have a medial, and more behind we have a posterior. Okay, on sagittal section, so it is clearly seen. Okay, so this posterior ethmoidal sinus open in the superior meatus. Okay, you can see. Then we have medial concha, this, and inferior concha. And between the medial and inferior concha, we have medial meatus. And we have many opening over here. Let's pay attention. We must be very, very careful to examine this part because they are very near to each other. Okay, but related to one structure, this is very easy to locate each specific opening. Okay, so we have here a depression. When you first insert your otoscope, so look for this depression. It is covered by mucosa, but it's clearly visible, this depression, and this is called hiatus semilunaris. Here, why they call so? Because it's look like half moon. It is covered by mucosa. Okay, it's covered by mucosa. Related to this, now we are going to locate each opening. On the interior side, here we have opening for frontal sinus. You can see this. Here. Okay, it's open here on the interior side. Okay, we have one more opening here. Interior ethmoidal sinus also open in the interior part of the hiatus semilunaris. Okay, and posterior we already discussed about posterior. This is not posterior. Okay, posteriorly we have accessory maxillary duct open. Okay, in the posterior end of hiatus semilunaris. Okay, so this is when the main duct which is located under the hiatus semilunaris and above the inferior concha. So when this blocked by something, so the accessory duct will open. Okay, in this case. Okay, so now and come to the inferior concha and inferior meatus. In inferior meatus, we have the lacrimal duct open, and lacrimal duct when closed. Okay, so the tear will accumulate. The tear and the all discharge of the eye is drained through this into the nasal cavity. When it has been blocked, so you will see S shape swelling over here. Okay, when you see that, so think about this, that the lacrimal duct has been blocked. Okay, so this was all about If you have question about nasal cavity, okay, we didn't discuss the nostril in entrance of the nasal cavity. This is nostril, okay, when you enter here, and in the entrance we have some dilated part. We call this is vestibule part. Okay, everywhere when there is dilated part in the beginning, they name vestibular part or vestibule. Okay, and the vestibule part we have, this is the only part where we have here. This is here a part of nasal cavity, and what happens sometimes, the skin microbe causes infection, or the outer microbe, it causes infection here, and you will see rashes, or rashes commonly appear, and uh, in this part. Okay, so first you will examine it for rashes, and then you will insert the otoscope for other first mucosal examination, whether it is smooth red, okay, or its color changes. If its color changes, so there will be some diseases. Okay, if it's red as compared to uh, oral mucosa, if it's smooth, not like the oral mucosa, there is no fur, whitish fur present. Okay, smooth and red. Okay, this is the normal color. Okay, if it's red and smooth, this is the normal. Okay, then you would see for different opening. If there you see some discharge from this pus or something, so think about the lacrimal duct. If you see here discharging or something from this specific meatus, so think about interior ethmoidal air cell. If you see discharging from this, so think about from the frontal sinus. If you see discharging from this, oh, we will not discuss this. Okay, here upper to hiatus semilunaris, we have a bulging part. Okay, this bulge to the internal nasal cavity. This is the bony bulging part. Okay, bone swell. Okay, because of internally we have the middle ethmoidal air cell. Okay, and it open by two opening here. Okay, and the nasal cavity. Okay, so this is middle ethmoidal air cell. Posteriorly, we have open in the posterior and the superior meatus. Middle air cell open in the bulla ethmoid, superior to hiatus semilunaris. So you can see here, this is the opening of this. If you see discharge or something like that, so medial ethmoidal air cell has been inflamed. Okay, or there will be problem. Okay, if you see the discharge or something like here, so there will be problem with the maxillary sinuses infection or something, and then it is very commonly infection occur in the maxilla because it's very nearest to the nasal cavity. Okay, and then we have the accessory duct. If it's closed, so this open, and the discharge will be discharged through accessory duct. Accessory means helper duct, so it helping. Okay, now if you don't have any question about this, please let me go for a physical examination of nasal cavity. Is it okay for you? Any question about lateral wall, nasal cavity, paranasal sinuses? No question? Okay. So we will go for physical examination of nasal cavity. Going for physical examination of external and internal nasal cavity. And before we already discussed the nasal cavity, our purpose is defined. Okay, this is defined that what we are looking for in the nasal cavity. Okay, if you don't know that what are you going to find out in nasal cavity, so it is nothing to do with the physical examination, because you will not be able to differentiate between normal structure and abnormal structure if you don't know the applied anatomy or basic anatomy. Okay, so now, before really go for this internal nasal cavity, we should start from the paranasal sinuses. Okay, can I start? Okay, so first you have to ask the patient, okay, permission of examination. or consent, and then when he allowed you, you must start this examination. Okay, so now I am going for frontal sinuses examination. You gently press this, but not very aggressively and forcefully, because it will be not painful, but painful due to your pressure. Okay, so is it painful? No. So it's clear. Okay. Now we are going for the maxillary sinuses. Okay. So it's located in the maxilla on both sides, the nasal cavity. Is it painful? No. Okay. Now we are going to examine external nasal cavity. If there is any node, if there is any painful area, so we will find out from the patient expression or to ask the patient. Okay. So start from the bony part and gently press. Okay. Is it painful? No. Then pay attention on the septum deviation, if there is any deviation, and not only on this level, internally we will examine the bony part also, if deviate one side or another side. Okay. Sometimes it not deviated in the anterior side, cartilage is normal, but deviated on the bony side. Okay. The bone deviated and the patient breathing compromised, and case of septum deviation. Okay, so we will examine during internal examination of nasal cavity if the septum is the central or whether it deviated to one side or another side. Now let's we will go for the internal examination of nasal cavity, but before really go for it, we will examine and ask the patient that put your one finger on one nostril and close it and expire with another nostril. So let's do it. Okay. Okay, so this is open, and okay, so both nostril is open and intake. Now I'm going to examination of nasal cavity internally. First, you will start from the nostril, the vestibule area. You can see here this is hairy part, and most commonly it's the rashes occur in this part because this is hairy part. And once you cross this, so there will be only red mucosa, and you can stay here if you, yeah, okay. You can see this mucosa. Let's show this. Okay, this is compared. This is smooth, and it's red, more red is compared to the oral mucosa, and there is no whitish fur on this. Okay, this is very smooth, and you must be very gently because there here we have many artery anastomosis. If you rupture it, okay, so there will be miss you bleeding in case of, and when the patient have problem with the bleeding, so he must have extreme problem and emergency. Okay, so that's why you must go this way. Okay, because this way there is no bony concha. So I can see this here, the medial meatus. Okay, the medial meatus, and there is no discharge, no swelling, no mucosa changes, so all is clear. Okay, so now it's finished the physical examination activity, and hopefully you understand it well, the anatomy part of the physical examination of nasal cavity and the physical examination part of nasal cavity, and this is the end. Okay, the next time we will go for oral examination, and we will create a new video for oral examination. For now, that's it. Goodbye.